What sex can do to a human body. Sex can have various effects on the human body, both physical and emotional. Here are some examples. Increases heart rate and blood flow. Sexual activity can cause an increase in heart rate and blood flow, similar to moderate exercise. Releases endorphins. Sexual activity can release endorphins, which are natural chemicals in the brain that produce feelings of pleasure and happiness. Boosts the immune system. Sex can help boost the immune system by increasing the production of antibodies and white blood cells. Reduces stress. Sexual activity can help reduce stress by promoting relaxation and the release of tension. Burns calories. Sexual activity can burn calories, although the amount varies depending on the intensity and duration of the activity. Improves sleep. Sexual activity can help improve sleep by promoting relaxation and reducing stress. Strengthens pelvic muscles. Sexual activity can help strengthen the pelvic muscles, which can help prevent incontinence and improve sexual function. Reduced risk of heart disease. Regular sexual activity has been associated with a reduced risk of heart disease. Improved self-esteem and body image. Sexual activity can help improve self-esteem and body image by promoting positive feelings about one's body and sexual abilities. It's important to note that the effects of sex on the body can vary widely depending on the individual and the circumstances, and it's always a good idea to practice safe sex and communicate with your partner about your needs and boundaries. Yes, it is possible for sex to become addictive for some people. Sex addiction, also known as hypersexuality or compulsive sexual behavior, is a condition characterized by a persistent and intense preoccupation with sexual fantasies, urges, and behaviors that interferes with daily life and causes significant distress. Sex addiction is a complex issue that can have various underlying causes, including psychological, emotional, and biological factors. Some of the signs and symptoms of sex addiction may include spending excessive time engaging in sexual activity or thinking about sex, repeatedly engaging in sexual behavior despite negative consequences. Difficulty controlling sexual urges or impulses, feeling ashamed or guilty about sexual behavior, using sex to cope with stress, anxiety, or other emotional issues. Neglecting responsibilities and relationships in favor of sexual activity, experiencing withdrawal symptoms when not engaging in sexual behavior. Treatment for sex addiction may involve therapy, support groups, and medication, and can be effective in helping individuals manage their compulsive sexual behavior and improve their overall quality of life. Sex is a natural human desire, but it is not essential for survival. There are many people who choose to live celibate lifestyles, and there are also people who are unable to engage in sexual activity due to medical conditions or other circumstances. However, it's important to note that sex can have many physical, emotional, and social benefits, and for many people, it is an important aspect of their overall health and well-being. The decision to engage in sexual activity or not is a personal choice and should be based on individual values, beliefs, and circumstances. If a person chooses to abstain from sex, it's important to find other ways to meet their physical and emotional needs, such as through exercise, social connections, hobbies, and self-care activities. It's also important to practice safe sex if engaging in sexual activity, to prevent sexually transmitted infections and unwanted pregnancy.